Hey, it's always good to hear that music on this Wednesday afternoon. That means Helping Seniors of Brevard is ready to get going for this Wednesday. I'm John Harper, and let's introduce the host of Helping Seniors of Brevard and the executive director of the organization as well. Here is none other than Kerry Fink. Hi, Kerry.
Hey, John Harper, good afternoon. It's always fun on Wednesdays because we get together around the radio right here on 90.3 FM WEJF. And thank you, too, if you're joining us online, as a growing number of folks do, at WEJF.net. And of course, those of you who catch this later as a podcast, we really are grateful that you're here. It's amazing as we go down the road. A lot of times what happens is people will listen to the Helping Seniors radio show, and then there'll be something that's really meaningful for them. And so then they're going to share the podcast with their friends, or maybe sometimes somebody tuned in late and they want to come back and catch the beginning. So that's why you'll find Helping Seniors podcast available every place that you find podcasts, from iTunes to iHeartRadio to Spotify. You'll find us right there. And so on behalf of Joe Steckler, our president and founder, we're now getting close to a decade and a half of service for the Helping Seniors organization in Brevard County. We're 100% local nonprofit. The only reason we exist is to do what our name says, Helping Seniors of Brevard. And so I love the topic that we're going to get into today, because for the better part of those, really almost all of the 15 years that Helping Seniors is close to serving our community, we've operated the County Senior Information Helpline. I'm going to give you a moment to grab a pencil and jot that number down. So I'm going to give that number to you. But the helpline is something that has helped thousands and thousands of seniors and their families. And we try to do our mission to inform, educate, and connect seniors to resources that are going to make a difference in their lives. And so when people call us, last year, it was 5,450 callers that happened on the Senior Information Helpline. We get calls about everything: housing, legal, medical, financial, transportation, you name it. We probably have taken a call on it. And the nice folks that you speak with, it could be Karen Wernland, or now are one of our growing team of volunteers. But everybody is committed to doing the best possible thing we can to connect you to a resource that makes a difference. And I can tell you through experience that one of the things that makes a difference is how much time is involved in that call. Here's what I mean by that. If somebody calls up and they've got an immediate situation, like it's got to be resolved tomorrow, the next day, or maybe even the next week, options get narrow, and we're all scrambling to try to find something that is going to make a difference in that situation. When somebody is able to plan ahead, and this is part of Joe's entire thinking, ever since I've known him, he's talked about we have to make an aging plan. It's kind of like a hurricane plan. You just want to know, you don't want the hurricane. You want to know how you would prepare for it and have your plans in place so that you don't have to scramble if they say one's coming your way. It's kind of the same thing with the aging plan. We want to get you ahead of the curve. And so our guest today is a longtime friend of the Helping Seniors organization. He is known not only locally as a fantastic part of the medical and business community, but he's also actually helps organizations all around the country serve their dental and medical practices better. His name is Dr. Lee Sheldon. Dr. Sheldon, how are you today?
Kerry, it's good to be with you this morning. Good, and how are you?
I am good. I'm excited about the topic of today because the preamble that I was giving about the helpline is it sure seems like the more time that you allow yourself to think through things, the better your decisions are going to be. And so one of the commonalities I guess we see in terms of calls is when people call us and say, hey, listen, 6 months from now, I'm going to need to do this. Our team loves it because it gives them a lot of options, a lot of ways to look at things. Could we consider this? Could we do that? What about this idea? Whereas if it has something that has to go down like in the next 48 hours, options get limited, they get expensive, and obviously you don't have enough time to research and get the best information. And so, kind of to launch us into our conversation today, which is what I'm so excited about, is the fact that we also have this thing like a lot of times we forget, Dr. Sheldon, we go into the dental practice, we go into the medical practice, maybe we go see an expert attorney, maybe we're seeing somebody that's really, very high up, professionally trained, very knowledgeable, very skilled in their set. And a lot of times as a consumer, we get intimidated and we tend to forget that we are actually the customer and that we have the power of choice, which is actually what we're going to talk about today. And Dr. Sheldon, it's that seems so obvious, but yet we forget that in a lot of cases where it really could help us.
We do, and we tend to become overwhelmed by things that we don't think we can understand, Kerry. I think probably the biggest skill that I may have developed over the years is to be able to communicate well enough that people can understand this in their own terms. And I'm talking about dentistry, that they can understand in their own terms. They can then be able to make the decision. And I related to something that we all do every day. We all decide what food we're going to buy and what store we're going to buy it from. And there are considerations on both. So we decide on the meal that we're going to have. We decide on the ingredients for that meal. We may decide on the recipe we're going to use. We then decide on the store or stores where we're going to buy that. And every decision has its benefits and has its ramifications. The same thing occurs in dental or medical care. We're going to come up with some examples later on in my own life. But we're going to look at that and we're going to say, all right, how can I make decisions and how do I make the decisions that are in my best interests? And that's what we covered in this article, which when will be in Senior Scene? Is this the August edition or September edition? September edition,
I think this will be September, yes.
Yeah. You'll consider that, but frankly, we're going to go into more depth on this today than we will. So, listeners, those of you who are choosing to listen to this, you're actually going to get more out of this than on the article that we wrote, because it's as I said, it's far and away different from dental care. I'm going to put it in a dental care perspective because that's what I live, and that's why you have me on the program. But everything we talk about applies to every decision you make in your daily life. I want to go to the first part of this, Kerry, that you brought up, and that was if we have an emergency, our power of choice is limited. We have to find the provider, we have to find the service, and we have to get it done. In dental terms, you got a toothache, I've got to get the tooth pulled, or I've got to get a root canal done, and I've got to make that decision real fast in order to be able to get that done. When we're talking about treatment planning and looking at long-term results and what our expectations are, and when I'm looking at I'm looking at a 5 or 10 or 15 or 20 year or a lifetime plan within dentistry, which is very similar to what Joe is recommending and has always recommended, as you said, with helping seniors. Then there are lots of powers of choice that you can make, and we just don't want to jump too fast.
As you're talking about that, I keep coming back to something because I have the opportunity to speak with a lot of very well qualified, even board certified elder law attorneys who are also in the helping seniors family. And, they're oftentimes confronted. Somebody runs into the legal office because somebody in the family has had a stroke and they're not able to make decisions or things like that. And now the family says, but we got to pay the mortgage. It's due on the 1st. We got to have access to the bank account. We got to be able to do this, that, or make this medical decision. And, the attorney says, well, where's the paperwork? And they said, well, we don't actually have that. And then things become very limited because in their channel, then they're talking about things like guardianship and having to go to courts. And it gets very expensive and very limited and maybe not necessarily the best outcome, whereas they often talk so often about, listen, do this ahead of time, a few $100s, you will have saved all of this grief and anxiety. And I think a lot of times, maybe first of all, we're bad about putting off making decisions just in general. And we think sometimes maybe if we put it off, it's going to go away. But the flip side of that is maybe a lot of times we're just intimidated. We don't even know the right questions to ask. So it's not that we're averse to power of choice. Maybe we just don't know that we are either equipped or intelligent enough to make good decisions. I'm not sure about that either, Dr. Sheldon.
Well, delaying decisions, I think, is the biggest problem. I've got a decision right now that I've been delaying for a long time, and I got to get on it. I got to do it. We all have those. But once we've made the decision, so we'll go back to dentistry for a second.
Yeah.
There are lots of decisions you can make. What's the work you're going to get done? Who's going to provide it? The worst decision you can make, and I'm going to say this across the board, is, the doctor says I need it. Well, is it covered by insurance? Good, I'll get it done. That's the worst way of making a decision.
Yeah.
Because it doesn't. What are you looking at? What are the risks?
Do you ever bring the
Yeah. So, I think that's an interesting point you're bringing up, Dr. Sheldon, the fact that if you're trying to make these decisions and it's really a process that you have to go through. And I know that you said you've got a couple of personal stories to kind of illustrate how you make the best decisions when you're coming up on these things.
Yeah, that's true. I'll go with personal stories, and we can go to dentistry. We can relate them all. Okay, so I have a little growth. It's called a hernia, and so I assume I've got a hernia. I know it's there. I go to the hernia repair guy, and he says, "Yeah, you got a hernia, and we're going to schedule it on such and such a date." And that was the end of the decision, or was it? So then I go, the hernia isn't bothering me that much, by the way. It's just there. And there was an assumption there. Okay, I got the hernia. I gotta do something about it. So I went to the medical literature and I looked at my age, what the downside risk is of repair versus the downside risk of waiting and see what happens. And the answer was there was no difference. If I were to look at the complication and the complication rate of repairing the hernia versus the complication rate of not repairing the hernia, the complication rates were the same. So I then said, well, gee, it's not bothering me so much. I was more worried about it because I thought hernias need to be repaired, but they really don't. The medical literature has lots of data on that. So I decided to put that off. Now, interestingly, during that same period of time, I was seeing a physical therapist who was working on my lower back and was working on the musculature in my leg, which happens to be just adjacent to where the hernia is. And as he relaxed the muscles, the hernia closed. Now, it didn't close completely. It isn't like a surgical closure. But in terms of the pressure in that area, the pressure on that area is reduced. And it's not bothering me a bit. Occasionally, I know it's there, but it's not giving me any discomfort at all. So let's take the first approach. I've got a hernia. Well, it needs to be repaired. I go to the surgeon. The surgeon says, yes, it needs to be repaired. By the way, the surgeon did not give me the downside risks. He gave me nothing. He just said, yeah, you got to pay. You got to repair the hernia. Okay. Then I go in the literature myself. I read it. All of us can go to, we've mentioned on this program a number of times, PubMed.gov, G-O-V, PubMed.gov. You can do your own research. You can read these articles and you can see what in fact is there for you. So there are ways. There's also Google Scholar you can go to, and Google Scholar will give you data, and you can look up any procedure you have done, so you can see what the results of that. But there's also the decision as to which practitioner you're going to see, and I'm going to go into dentistry, and we'll go into those examples and those other examples in a second. Kerry, is that okay with you?
No, that sounds good. One of the observations that I wanted to make as you were talking about this is, see, I think there's an important point that we can learn from you going through the discussion you're having about the hernia thing. You did not simply ignore it and say, I'm just going to shelve this. I'm not going to do it. And I'm just going to put it off until something else happens. You were proactive. But the second thing that I think is an important takeaway as you're relating that story is the fact that, the problem is we go into the surgeon's office. The surgeon's the expert. My goodness, they have a huge, thriving practice. They've done this for years. They're very successful. They have so much more medical experience than we do, and so when they proclaim it, we almost want to take it as gospel. and to your point, it takes a lot to say, okay, I've heard all that. I've taken in this data, this information. Let me go do some more research, and I'm going to come back to you with my best decision. And like we've done programs before, Dr. Sheldon, where you've talked about the importance of a second opinion. We've talked about just the importance of doing your own research and things like that. So to me, it's like a good example of how we ought to approach it. And the other thing that was very fortunate in that particular case was that you took advantage of the time. So it wasn't like, oh, this is an emergency. If we don't fix this, this is going to be the outcome. You had a moment where you could step back, analyze, and then come to the correct decision.
It's true. And too often, particularly in medical care, where we make the decision based on what the doctor tells us. And I'm not saying doctors aren't good decision makers. They are. But sometimes the doctor is looking at it only from his or her perspective and isn't necessarily looking at it from the patient's perspective. The doctor's looking at it and say, well, I know how to repair. This is pretty simple repair. All I have to do is put the patient to sleep for 45 minutes. It's going to be all done. And I know it's going to be repaired and everything's going to be okay in my universe. Okay, not in your universe, in my universe, I know everything's going to be okay. I have minimal risk. Oh yeah, occasionally we have an infection, stuff like that, but we can treat that with antibiotics. And that's it in my universe. And my universe is not the same as your universe. And your universe is not the same as Kerry's universe or John's or Jim's or anybody who's on this program right now. All of us have developed our different viewpoints over the years based on what? What's worked for us, what seems to be okay for us. That's how we make our decisions. That's how we decide what cut of meat we're going to buy. That's how we make a decision of what store we're going to go to. That's how we make the decision on what pan we're going to cook it on and what oil we're going to use and all those types of things. It's a product of all of our experiences, but all of our experiences are different. And so viewpoints are different. Every viewpoint is different. And for you out there who's listening to this right now, your viewpoint is different from mine. It has to be. Your product of your life's experiences is totally different from the product of my life's experiences.
It's so important because, again, it's about you having the power of choice. You said this came up also in a case for your wife as well.
Oh, my goodness. Yes. My wife is probably the best example of what occurred. And that was that she decided to get a diagnostic something. I won't say what it is. She decided to get a diagnostic something. And we can talk, and we've talked a little bit, and we can talk about diagnostic screening and the value of that on another program. But she got the diagnostic something, and so I get called in the middle of my day. It's when I'm in active dental practice, and I get a call from the doctor's office. You got to come over here right away. Okay, so all of a sudden the emergency bells are on. What did the doctor find? And so I cancel my last few patients and I drive over there, and the doctor shows me whatever it was that was occurring on the diagnostic instrument, and said, you got to have this taken out because of blah, 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 blah. And so my wife is still half asleep. And I'm given this emergency call saying, which wasn't an emergency at all, by the way, but it was certainly presented as an emergency. You got to get this taken care of. And I'm going to refer you to so-and-so. So referred to a surgeon. And the surgeon said, yeah, we got to do this. And it's going to be about a 6-week recovery. And we're going to have to remove a big part of a particular area. It'll be okay. We have to remove a big part. I'll tell you, a big part of the intestine in order to be able to take care of this. And you'll have blah, blah, blah. So is it cancer? We don't know. We don't think it is, but it could become cancer. And the doctor said, so then I go back to the original diagnostician, who's not a surgeon. And I said, all right, what's the chance this is going to be a problem? I'd already looked it up. I said, and I looked in the research, and in PubMed, it said there's a 2% chance of it being cancer. And in one study, it was less than that. And what did the doctor say? The doctor said there's a 75% chance it's going to become cancer. So already I'm getting conflicting information. Okay. And by the way, this doctor was recommended to me by another doctor of the same specialty who used to live here but no longer lives here anymore. So already I've got conflicting data. I wouldn't have had that conflicting data unless I'd looked in the literature to find out what the real cancer rate was. So then I said, well, there's got to be a better way of repairing it than this. You're saying you got to cut out all this stuff, and she said no. And the surgeon said this is the only way that can be done. And so I'm approaching the original diagnostician. I literally said 3 times, there's got to be a different way. There's got to be a different way. There's got to be a different way. All right, I agree it's got to come out. There's got to be a different way. Finally, after she was probably sick of listening to me, as probably many of your listeners are, but probably sick of listening to me, she said, well, yeah, there is a guy at Mayo Clinic who does it non-surgically. We drive up to Mayo Clinic. The doctor does it in a day. Everything's okay. We come back and everything is done non-surgically rather than cutting out a big portion of the intestine. So, I mean, I'm a doctor guy, and I was the one who had to beat up this other doctor guy to finally find out what alternatives there really were. Well, it's going to be more difficult for you to fight against doctor than for me. For Pete's sake, I had a TV show for over 8 years. I've been on radio all the time. Every doctor knows I'm going to give them a hard time. They're either going to come up with the data or they're not. But it also goes to the point that you can look up any procedure and you can look up objective risks. Now you'll get opinionated pieces, and I would caution you against that. But the nice thing about medicine and dentistry is that there's lots of objective data that is published. You know, we've talked about the papers that my group has published over the past 2 or 3 years. Lots of objective data where you can read it, you can determine for yourself, and don't necessarily have to jump. Now, if you're in pain or if it's a horrible infection or something like that, you do have to jump. But on these other procedures, yeah, you can spend a little bit of time just taking a deep breath. And the worst thing you can say for yourself, well, I can't understand that. That's way beyond my knowledge base. And the answer is no, it isn't. You're only choosing for it to be beyond your own knowledge base. Read a little bit. You'll find out some data that may very well make your life a lot easier.
Yeah, we're talking with Dr. Lee Sheldon of Doctors Sheldon and Furtado Solid Bite, and having a really good conversation about the importance of the power of choice. We're going to be back with the second half of Helping Seniors Radio in just a moment. So stay tuned, and we're going to keep on this, that you are the king of your choices on Helping Seniors Radio.
And we're back for the second half of Helping Seniors of Brevard. I'm John Harper, and let's reintroduce the Executive Director of Helping Seniors of Brevard and the host of the show, Kerry Fink. Hi, Kerry.
Hey, John Harper, thank you, and welcome back to the second half of our lunch hour. We do this every Wednesday right here on 90.3 FM, WEJF, and if you're listening online at WEJF.net, we appreciate you being here. And for those of you who catch this as a podcast, thank you for continuing to listen. You know, if you're not catching this as a podcast, let me remind you one of the reasons that we do the podcast. We also put this out on our Helping Seniors of Brevard website, which is, give you a second to grab that pencil so you can jot it down, but it's pretty simple. It's helpingseniors.org. You can also use Helping Seniors of Brevard. Find us and like us on your Facebook page, and you can find these broadcasts also on the Helping Seniors of Brevard YouTube channel. And what we find is a lot of people like to come back. They'll hear a good point of conversation. Maybe they want to maybe catch some specifics of it, so they'll go back and find the podcast, or maybe they just want to share it with somebody that's important in their life. So we appreciate you being here. We're having a great conversation with noted area periodontist Dr. Lee Sheldon of Dr. Sheldon and Furtado Solid Bite. And it's an interesting conversation we're having today because it's something that we understand or we recognize when we make simple decisions. We get to choose the gas station we go to or the grocery store or which movie we're going to pick to watch this weekend or whatever. We don't have a lot of trouble with simple choices, but for sure, if there's a more complicated, bigger choice, particularly when it comes into the world of dental or medical, or maybe it's legal or something like that. We have some big choices with big ramifications. And I think the important thing that Dr. Sheldon is helping us get to think about is that we do retain the power of choice. And Dr. Sheldon, I'm excited to continue the conversation. We had some great kind of like stories, but you've seen them also in your medical practice. There was a story you and I have talked about along the way. You had a night watchman who hadn't seen a dentist for 30 years. And again, this is, I think, a great lesson in kind of the power of choice.
It was, because here's a patient, or a person, not a patient, who decided not to get any dental care done since he was 15 years old. His mouth was a mess. He was a night watchman because he didn't want to encounter anybody. And you know that a night watchman's salary is not that great, and he didn't look good. And he said, I want what you do. And we said, yeah, it's going to cost this and so. And, after you go through the shock factor of what it would cost, because there was nothing we could do to save the teeth at that point, then he went through the process and did the things that he needed to do in order to get the work done the way he wanted to do it. And so he has a nice smile. And of course, as soon as you have a nice smile and you are able to chew again, then you're not thinking about your teeth every minute of every day. And you've made that choice, and then your life changes. Then you do things differently, and perhaps you make more money. I didn't ask him, but there are plenty of people who have made that decision. And as a result of the decision they made for their mouths, then lives have changed. And so that happened for this individual. But it goes also back to something at the beginning, Kerry, and that is when I opened up my practice, I had a particular viewpoint. And the only one who could develop that viewpoint within the practice was who? Me. I knew what my viewpoint was. I know that my viewpoint was not necessarily the viewpoint of the person down the street or even the person across the country. I mean, part of the reason that I speak in different places is why? Because I think a little bit differently from other people, and so they're interested to hear what I have to say, or at least they were. Or maybe they're not anymore, but they were at one time. Well, there are the opportunities for us as individuals to develop our own viewpoints. I think if we're going into a private practice, then I have the ability to develop my viewpoint. And now Matthew and Michelle have come in, and if their viewpoints correlated with mine, then they could practice within that environment. If not, it wasn't going to work. So I developed my viewpoint over a number of years based on my patient experience, and my patients decided to develop that viewpoint or to take advantage of that viewpoint that I provided. That's a little bit different from a corporate entity owning the practice, because then I, as a doctor, have to be influenced by what that corporate entity wants me to do. And therefore, while I don't think I'm doing it, I am changing my opinion based on what the corporate entity has told me I have to do.
That's an interesting dynamic by itself, because a lot of times, I like to use the term a lot of times when we're talking about medical or things like that. The term that society uses is they say somebody is practicing medicine, which by definition, when you use a term like practicing, means some people are going to be more virtuoso than other people. And so it's an interesting dynamic when we talk about the power of choice. And I think this was going back to even one of the opening points, is that when you, as a consumer, you go into somebody that clearly the scale isn't equal. I mean, they're so advanced in terms of their skill set and their knowledge about whatever particular circumstance that you're trying to tap their expertise about. I mean, Dr. Sheldon, we could go well past the medical and dental community. We could talk about, the person who comes over and says you have a problem with your roof, or, something, this tree needs to come down in your yard, or just different things like that we really don't have the, the skill set to on our own understand. And a lot of times we get, I don't want to say browbeat, or maybe we get intimidated into just assuming, well, that's the way it's got to be done. And I think some of the stories that you were relating in the first half of the show really speak to that. And I think to even take that a step further, Dr. Sheldon, what you said is different. Like when you go into a practice that is 100% local, you are dealing with the principals, the decision makers, the folks who stand behind their work. And I'm not saying anything negative about a corporate environment, but it's true that somebody in some headquarters miles away is telling those people pretty much, here's the lanes you have to stay in. Does that happen? I think that probably does happen a lot, particularly in corporate dentistry. But am I right or wrong about that?
No, there are quotas that are imposed upon the assistants to sell certain things. I mean, that's common. And there are certain laboratories that the doctor or the office will use. I mean, these are two examples of what requirements may be imposed on the individual practice that may be out of the doctor's control. Now, we've talked about the fact that that we've done research or we're providing research or providing data to show that periodontal disease needs to have certain standards of care, and not standards of care, let me put it, guidelines in terms of practice of periodontics. But if we're to look at that and look at those guidelines, put that in terms of the patients that I see. Patients will see us, and I just had one yesterday with severe periodontitis, and he was told that he could be treated by the general dentist and go to the hygienist and they'll do the best they can. And the answer was no. Within that environment, I know the environment. I also know the environment that a periodontist provides. He could not have been successfully treated there. So. Why even start when the periodontitis is severe? He's lost anywhere between 50 and 75% of the bone support for his teeth. He's 45 years old, and he's coming to me, and he says, well, the general dentist says they can do this, and I know darn well that they can't do it. So there's got to be that decision as to who the best qualified person is. And so this person said, well, I'm going to look online. I'm going to see who's got the best Google reviews for this particular thing. And I'm going to see a specialist in this disease. And he showed up in our office. And on the other side, we see plenty of patients who've been told they need the procedures that we do. And I look at them and they barely need a cleaning. And so we've got an ethics problem as well, or perhaps a misidentification problem. We can't, we think we see something, and therefore somebody tells us we need to do something based on that. And yet I'm supposedly an expert in the field, and I look at it and I say, no, you don't. So this is a bit painful. And at this age, I'm able to say things that I might not have been willing to say 20 years ago. But there is a problem here where we've got to look at the best qualified individual, and also we have to get an individual that matches our viewpoint and that we can discuss ramifications with, so I can understand the parameters of our decision. Example, we went back to the hernia discussion where the doctor said, well, you need to have the hernia repaired. At least when we come into our office, I'm saying, well, listen, we may need to do this, but here's why we do need to do it. And by the way, here's the downside risk of doing it. You make the decision for yourself. Whether we're talking about an implant or periodontal disease treatment, or whether we're talking about ridges or crowns or whatever it is, there is room for discussion. It's the reason we spend as much time as we do with our patients, which is a 2-hour visit each time, so the patients have a full understanding before they make that jump. And then once they have the full understanding, then they can decide whether they want to see us or whether they want to see somebody else. And maybe for that other person, maybe somebody else is better, but at least they have the imposed thinking time and the presentation time, not sales time, but presentation time, so they can understand the ramifications of their decisions.
It goes back to that whole conversation. The power of choice is really, I was thinking about that, the patient you were describing that came in with the fairly severe periodontal disease. At least they were smart enough to think like, okay, let me go farther on this. Let me see if I can make the best decision for myself. And that's a little bit like the lesson, what we're talking about. And there's another point that I want to kind of have us talk about for just a moment too, is the fact that, we talk a lot in the helping seniors world about the importance of doing things locally. And I'm taking this well outside, well, pretty much with medical. You end up having to, at the end of the day, be local or dental. But the point is that we touched on a little bit about the difference between corporate and local businesses. Doesn't mean that a corporate situation can't be a good viable option, but there are definitely constraints. We talk about this all the time, Dr. Sheldon. Like we talk about people when they're looking for Medicare, people when they're looking for trying to find, the right assisted living situation for mom, dad, aunt, or uncle, or whatever, or a reverse mortgage, or any kind of like big ticket item like that. And what happens is a lot of times we get inundated on the television with maybe some TV person that we really enjoyed their TV show back in the 70s. And now they're telling us, give us a call at this 800 number. We're going to get you set up with whatever the solution is to your situation.
Come on, we all like Tom Selleck and we like Joe Namath, don't we?
Yeah, sure. They're wonderful in their careers, but talk about staying in your lane, right? So the problem with this is that you end up calling this 800 number, and you're talking to somebody, I don't know, Iowa, Indiana, wherever the call center is located, and they're going to look on their computer screen and try to tell you what's the best solution for you in Melbourne, Florida, in Satellite Beach, Florida, in Palm Bay, Florida, and what seems to be missing from that conversation is the ability to get somebody who's local, boots on the ground, who is right here in the community, who is your neighbor, who has that expertise, but then some, because they really understand the local marketplace. So when we're talking about, for example, a reverse mortgage, every state has different licensure requirements and different restrictions. Whether we're talking about Medicare and things like that, you need to know which doctors participate in which plans and what prescriptions are included and what aren't, and different things like that. And Dr. Sheldon, that kind of comes back to, as the consumer, you have that power of choice. I know there was one more story that we wanted to get in here, that you were talking about a divorced woman who couldn't go get dental care under orders of her ex-husband. Wow, that sounds awful, actually.
Yes. So while she's married, I want my teeth to look better. And at least according to this woman, she said, okay, if you want your teeth to look better, go extract your teeth and make a denture. And she said, I don't want to do that. And so then they got a divorce. And who did he marry? He married somebody with a better smile who was younger. Oh. And apparently there was enough money that came over. She said, I can do the work the way I want to do it. And so she came to see us. So we did the work that needed to be done. And she posted her picture on Facebook, and her high school boyfriend saw her. Her high school boyfriend, I think, was in California or something like that. The two of them are together now. So isn't that a nice end to that story?
The power of choice, right? Making the decisions that are going to really improve your life. But so as we're talking about this whole thing, we've done shows together where we've talked about really why, as a medical practice, you choose to do certain things. We did a show, I think it was last month, where we talked a little bit about dental insurance and how you find that for most people, it's really not helpful in the way that it needs to be, either for their purposes, but really, as you look at it from a practice side, to make sure that you're giving the best care that the patients are really needing. And
the best decision. Go ahead. I'm sorry.
No, go ahead. Go right ahead.
The best decision I made when I opened the practice was that I was not going to accept insurance. Now, that sounds horrible to most of the people, or to many of the people who listen to this. The best decision I made was that I wasn't going to accept insurance. Now, in the middle of my practice, for 6 months, I signed down with one program just to see what it was like. And sure enough, it was the best decision I made, because it took me another 12 months to get out of that program.
Well, so isn't this back to the power of choice, that you looked at it from a practice standpoint? And I remember this kind of ties into that whole thing about corporate, where there may be a certain pipeline and certain things are allowed, but that may not be the best for the patient, or vice versa. And by you being able to be that 100% local practice, you're really able to look out for the patient's best opportunity. And interestingly enough, we've had the conversation that kind of like flips the other side, actually would probably reduce business. Like we've had these conversations, even though you do so much with dental implants, we've done shows together where you said, is a dental implant always the answer? No. And then we've done shows where you've even talked about too many teeth are being extracted out in the marketplace, and that you'll fight against, snap decisions that just like, oh, let's yank the teeth out and go with dentures or whatever, because you're able to look deeper into the whole situation.
Well, it went into that decision yesterday with that 45-year-old, because I said some people will say you need to have all your teeth out and you put in implants, and that is not what you need to do. And he nodded his head. Apparently, he'd already heard that from somebody. So I'm not saying the viewpoint isn't correct for the particular individual who said that, but that viewpoint isn't correct based on of that doctor's knowledge of periodontal disease and what can be done. My entire career and yes, I know we're known for dental implants, and I'm proud that we're known for dental implants, but my entire career has been based on saving teeth when they can be saved. With the number of patients who've come into our office and they've been told by others that teeth need to be extracted and they need to have dentures, and I look at them and I say, no, you don't. And, 30 years later, 40 years later, they still have their teeth. So, you are hiring a viewpoint, and how well-trained that viewpoint is, and what the experience base is of that person, and what the ultimate goals are that person wants to achieve, have very much to do with what that opinion is going to be. And that's why the second opinion is important, simply because you're seeing somebody who has a product of experiences that may be different from the product of the experiences from the original person. Yes, there are still viewpoints and there's still opinions here, but they're also based on data or what's worked for us or what's been successful for us in our own practices. That's why there's so many of us out there, and so many of us practice differently. And you've got to find the person who practices the way you want to be treated.
I think that's, again, as we're talking about the topic today is power of choice. And, you and I have had this conversation as we talked through different things, how you operate in your practice. In fact, at this point, it's really your son, Dr. Matt Sheldon, who I remember was honored not so long ago for being one of the top dentists in America under 40, and the Dr. Sheldon Furtado, who is a periodontist, with exceptional training and skill sets. And really, you're kind of like consulting and helping to make sure that everything moves in the right direction. But we've talked about this on the radio before. There's many times that you've empowered the people in your office to be part of that whole diagnostic. The patient needs this, and they'll question sometimes like, what is this really what the patient needs? And you guys will have that dialogue to make sure that the best outcome is happening for the patient.
We will. I mean, this assistants ask me questions, and they say, what if we did this? And how about if I look at it this way? And, sometimes I'll take their viewpoint because their viewpoint may have been something that I didn't consider. But yeah, I mean, if you can explain things well and you are up for the challenge, at least I can take the viewpoint of the assistant, because the assistant is really looking and asking questions based on what she thinks the patient might be asking. How does she know? Because when I leave the treatment room, the patient is asking those questions of the assistant. So why not ask those questions of me while I'm there, that the patient might be too embarrassed to ask, and get it all up front? The better I am at fielding those questions, the better it is for the patient, the better it is for everybody, because there's open communication, not, well, you can't challenge him, you can't say this, you can't say that. And I'm probably better at it now at this age than I was 30 or 40 years ago.
Yeah, we're talking with Dr. Lee Sheldon with the Power of Choice. We're going to talk about a couple of things of power of choice, but I want to get into the power of choice that you might win a new car. That's the Helping Seniors fundraiser. Before we get there, though, Dr. Sheldon, there's a power of choice that you could make today, which is to get a really good idea of what's going on with your own mouth, because Dr. Sheldon, you through Dr. Sheldon and Furtado have a great program that helps us as a charity, but really it's designed to help the patient get a real good understanding of everything that's going on. And at the end of the day, give you a real good understanding of what's going on in the patient's mouth so that you can give that best kind of like overview of what needs to happen. It's called Solid Bite Gives Back.
And Solid Bite Gives Back essentially allows you, the listener who is listening to this program right now, to call our office at 321-259-8000 and say, I heard Dr. Sheldon on the radio. I'd like to have his examination and just bring a check for $50 to our office and make it out to Helping Seniors of Brevard for $50 or more. And you'll get all the examination, the x-rays, the CT scan, everything in 2-hour experience for that $50. My wife was just going over the stats 2 days ago. We have collected over $270,000 on the Solid Bite Gives Back program.
Wow. Well,
that's been distributed to other charities. It's charities based on, you decide which charity, and Helping Seniors of Brevard is one of the 6 charities on our campaign. So you write your check out to Helping Seniors of Brevard, and all the money goes to to Helping Seniors.
Yeah, it's what I call a win-win-win, right? Because you as a patient get something that's really $600-700 worth of value in terms of really getting all the information you need, the CT scan, everything that's going on. You win as the medical professional because now you have all the data you need to make the best call or advise the best course of treatment. And for Helping Seniors, of course, it's a real win-win-win because we can only go as far as you go. And so as you allow us to go, I guess, through the fundraising. And, that's one of the reasons I want to kind of close out the show and talk to you about our big fundraiser. It's a date you want to get on your calendar. So I'm going to give you a moment to grab a pencil, throw it down on your calendar. But it is Sunday. We're going to get together Sunday, October 27th from 1 p.m. to 4 p.m. So it's just a few months away. And you're going to really have a great time. You don't have to be present to win. It's the Helping Seniors car raffle. But if you're in town, why would you miss it? It's become an annual tradition now at Mark Pylock's American Muscle Car Museum. And Dr. Sheldon, as you know, that's that huge. They told me the other day he's almost up. It's like 480 cars, Dr. Sheldon. He keeps adding cars, but it's that beautiful complex right there on Sarno Road, not far from where your medical practice is, actually. And he every year since he's been open, we don't take it for granted, but he's been so gracious to the Helping Seniors organization. He's allowed us every year he's been open to have our grand opening festivities there. And to be honest, he does that out of his own pocket. He, when the sodas, the waters, everything that he provides, all that is he's taking care of. So when you buy that raffle ticket, you're really just going directly into supporting the work of Helping Seniors. And the fun thing is that at the end of that, well, it's actually not the end of the day. They kind of do it partway through the day. Somebody's going home in a brand new car. And so this is actually the 8th annual Helping Seniors car raffle. There are 7 great automobile choices. Dr. Sheldon, your office is a pickup point. People can wander into your office and you've got, well, I was just in there the other day and I was so happy to see the little poster and the fact that you guys have the tickets available.
The sign is up. Come on in. You do not have to be patient. Buy some tickets and hope you win.
Yeah, one ticket is $25 donation. Even with inflation and everything, Joe has really said, Kerry, let's keep this the same way we've been doing it. It's a good program. It works. $25 donation is one ticket, and 5 tickets, a $100 donation. And the wonderful part about that is that you get 3 things when you get a ticket. You're supporting the work of Helping Seniors. That's important. This is like half of our budget. We need your help to do the things that we're doing. There are more seniors, not less seniors, every day in Brevard County. There are more calls, not less calls. And there's more work to be done, not less work to be done. So we do need your help. It's a donation to Helping Seniors. Number two, you could win one of these fine brand new cars. I mean, I don't even have time to list every car, but my goodness, you could pick a Chevrolet Colorado truck this year. You could pick a Jeep Compass. You could pick like our winner did last year, the Mitsubishi Outlander, a great little SUV. There's so many great cars to choose from. But the third thing you get is the opportunity to join us at the museum, and it's going to be fun. It's going to be a daylight event this hour, so easy for everybody to get in and out of the museum and during daylight, both sides of it. And number two, it's family friendly, so you can bring your kids, your grandkids, your family with you. If kids are under, I think it's 10, then they get to come in for free, two of them with a paid adult. And then the third part of this that I think is really so much fun is that because we're going to expand, so we're going to be inside the museum because it is a daylight event. We're also going to be able to do some things outside. And so that's going to make it feel even less crowded because we had a record number of people who showed up with us last year. Dr. Sheldon, you were there. You saw, I mean, talk about the museum and the experience.
And we've solved that problem this year. So there's no problem with crowding. There's more hours. It's going to be during the day. You can be outside. You can be inside. You'll get the same fine services that Mark provides for you, and you'll see some beautiful cars.
Oh, my goodness. So you got to do this. How do you get a ticket? Stop by Dr. Sheldon's office right there on Sarno Road. Come by the Helping Seniors office right there at 1344 South Apollo Boulevard, second floor. You'll find Joe's Senior Resource Center. And then you can also call, get tickets by phone, 321-473-7770. And if you like to use the internet, you can get your tickets safely and securely right there, HelpingSeniorsCarRaffle.com, HelpingSeniorsCarRaffle.com. Well, that's about the time that we have for the radio show for today on Helping Seniors. Thank you, Dr. Sheldon, for joining us. Real quick, the phone number, if somebody wants to take advantage of the Solid Bike Gives Back.
321-259-8000.
Okay. Don't miss that. And don't miss joining us next Wednesday, 12 noon, right here back on 90.3 FM, WEJF. See you then.